my name is Shannon Cisco, and my persuasive speech for you is going to be on those who are receiving government assistance on federal programs should be required to do drug testing, volunteer service hours, some type of training. Requiring individuals to do drug testing, workforce training, volunteer hours will give them the tools and the skills and the proper needs into help finding a job, not only closing the employment gap, but also preparing those individuals on government assistance a better overall situation than the one that they're currently in. The federal welfare reform in 1996 began as a temporary assistance program for needy families. Unfortunately, these programs turned into long-term, and individuals have been on them decades after decades, generations after generations in some families. According to the National Conference of State Legislators, as of March 28, 2016, at least 17 states had proposed to address the substance abuse and drug testing for welfare programs. As you see here across on the map, this is the map of the United States. These are all the states who are having issues with the same very problems of money constantly going out to individuals for needy families. According to the West Virginia legislator, Senate Bill 6, West Virginia created a 3-year pilot program to screen welfare applicants for substance abuse issues. If the caseworker has reason to believe that the applicant is abusing drugs, a drug test will be ordered. Applicants who test positive and attend substance abuse treatment, counseling, and job skills program can continue to receive benefits. Applicants who refuse the drug screen or test are ineligible for assistance. Now, Maine finally took that bold step towards welfare reform, and it paid huge for Maine. Last year, according to Maine, passed a measure that would require recipients who use supplemental nutrition assistance program to complete a certain number of work hours, volunteer, job training hours, before being eligible for assistance. After forcing these individuals to either work part-time for 20 hours each week, enroll in a vocational program, volunteer for a minimum of 24 hours per month, the numbers showed a significant drop from 12,000 enrollees to just over 2,500. According to the Health and Human Services Committee, offices of Ike Leggett, in July of 2015, the proposal physical for 2016 was proposed. He had submitted to Montgomery County that there would be a $50 million cut, and all of that reducing library hours, delay of arrival of police body cameras, part of an effort to deal with, the lower than expected revenues from Montgomery County collected taxes. So Montgomery County is putting all of these monies into low-income families and all of these services. None of the money's coming back within Montgomery County local taxes. About 29 million of these expenditures are offset by revenues, such as the federal financial participation, Medicaid reimbursement. And just starting 2016 is a total expected lapse of 8.3 million. And this includes all of the health care for the uninsured, working parents assistance. So before 2016 even began, we were already short 8.3 million. And this forces the cuts in, very important things of supportive services for emergency family shelters, children's opportunity, positive youth programming, the list goes on and on and on. As you see here, according to the charts, the list has gone completely up. We are now up to 41 million in 2011 of the income that is actually going out. And as you see here, the income going out for food stamps and all of, the federal for neediest families is significantly higher than the job training. So if individuals who receive welfare benefits volunteer, drug test, apply themselves, working hard and learning new skills in the job, they can build their resume, which will open up more doors of opportunities down the line. It's not the government's job to take care of the poor who are able-bodied. The Bible clearly states if a man doesn't work, he doesn't eat. The principle here is that every person is responsible for taking care of themselves. And even in a bad American economy, there are still opportunities galore to be had for those willing to work hard.